Great. Well, thank you for coming to our Medicare seminar today for the Mayo Credit Union employees. My name is Dave Brown. I am with TrueLink Medicare Advisors, and we are owned by the Minnesota Credit Union Network. So the Minnesota Credit Union Network is a nonprofit that's a trade association for credit unions in Minnesota, and we do advocacy work for credit unions and all that sort of thing. And we started this agency going on 4 years ago now to help credit union members needing help with Medicare. We'll actually help anybody who needs help with Medicare, but we were designed to work with credit union members who want someone who's been vetted and reliable and all of that. So thank you for attending today. Again, my name is Dave Brown. I've been doing this for 18 years now. So anytime during the presentation, if you're online watching or in person, if you have questions, if you're in person, just raise your hand and we'll try to answer questions as we go along. If you're online, if you enter it into the chat, we'll try to address those as that comes up. So with that, we will get started. So for disclosures, just letting you know, in Minnesota, we're licensed in numerous states, but in Minnesota, we offer all the plans, Medicare Advantage plans that are available in the state. We offer many of the Medigap plans and the Medicare Part D prescription drug plans. So we cover the gamut in that area. This is an educational event. We're not selling anything today. It's for your education. At the end, if you're in person, and for you who just walked in, we do have a brochure on the back counter for you and some refreshments if you would like. And but inside of this, there's some information, contact information, but also a card. It may be white, yellow, this color. If you fill that out, if you include your email address, I'm going to just send you a thank you for attending today, and then I'll ask you if you're in need of our help. If you're not in need of our help, that's the last you'll hear from me. But if you are, then we can work when the time's appropriate to schedule a time to set up to work with you. If you're online, you're going to be receiving information in an email this afternoon, and there'll be a slide at the end of the presentation that has my contact information, and if you're in need of help, just feel free to reach out at that time. So with that, we will get started. We're going to cover the basics of Medicare. Our agenda is why would you want to work with TrueLink Medicare Advisors? What is Medicare? What does it cover? What doesn't it cover? We're going to talk about the different enrollment periods and deadlines, your costs that will be associated with Medicare. What if you decide to work past the age of 65? We'll talk about how that works. And then your private health insurance options. Around the time that you turn 65, you probably see your mailbox filling up with advertisements based on Medicare agents wanting your business. There's a lot of direct mail, digital advertisements. In the fall, TV's full of Medicare advertising, September, October, November, asking you to call this call center, and they'll sell your information to somebody, and then they'll be calling you, which is one of the reasons why we're here. We're hoping that you use us if you're in need of help. With that being said, if you are employed by the Mayo Clinic in Rochester, and you started employment prior to January 1 of 2001, you are probably going to be eligible to get your Medicare supplemental insurance through a company called VIA Benefits. When you do that, you're going to be allotted health reimbursement money every year. So if you're in that category, your HR is going to let you know, but you wouldn't want to use us in that respect. You're going to want to use VIA Benefits because that's how you're going to get your health reimbursement money if you qualify for that. We're here to answer your questions. I've helped a lot of Mayo employees who've retired and they just wanted a second opinion before they made their decision with VIA Benefits. We're happy to schedule a time with you just to let you know the differences and what your benefits would be if you're here in Minnesota and work for the Mayo Clinic. This doesn't apply to the Mayo Health System. They're not eligible for the VIA Benefits, but Mayo Clinic employees in Rochester are. So if you use our services, there's never a cost to you. If you end up signing up for a plan through us, we get paid a commission by the insurance carriers, but we're here to help provide education, to help you understand the whys and hows of Medicare. Like I said, we offer multiple companies and insurance carriers. Medicare is not a one-size-fits-all. Just because a friend or a spouse or a neighbor has one plan that may not be the right plan for you. If you meet with us, we're going to review your prescription medications that you're taking and make sure whatever plan you go with covers your medications. We'll make sure your doctors are in network if you go with that type of plan, and so on. And we're available throughout the year for questions and assistance. I get calls probably every week from existing clients who they got their bill from the insurance company and they were charged money that they shouldn't have been. It gets billed wrong. They knew when they went to see their general practitioner they don't have a copay, but they're getting bills. So we do three-way calls with the insurance carrier to get that straightened out. It happens more than you would think. And then every year, if you're our client, we actively review your prescription drugs at least to make sure that the plan you have this year is still going to be the right option for you for next year. So Original Medicare Parts A and B. Original Medicare Part A, it provides coverage for hospitalization, skilled nursing, home health care, and hospice. There is not a monthly premium for Medicare Part A if you or your spouse has worked in the United States for at least 10 years. The Medicare tax that gets taken out of your paycheck every pay period, that's what helps fund the Medicare Part A. There is a monthly premium for Medicare Part B. And Medicare Part B is going to cover doctors and specialists, outpatient surgeries, therapies, medical equipment, ambulance, all those types of things. This year, the monthly premium for Medicare Part B is $202.90 a month. We will discuss the different income levels that could either reduce that or cause that to go up in a few slides from now. So Original Medicare, there's certain things Original Medicare does not cover. They don't cover comprehensive dental. They don't give you worldwide coverage, routine hearing exams, fitness benefits, eye exams and eyewear, or outpatient prescription medications. That's why you would look at buying some sort of supplemental coverage for that. And something else a lot of people aren't aware of is that Original Medicare no longer covers an annual physical. So they'll cover an annual wellness exam, but that's a lot less of examination than what an annual physical would be. If you go with a Medicare Advantage plan, most of them will pay for an annual physical. If you go with a Medigap supplement plan, they will not pay for an annual physical. So when we get to those slides, we'll talk about that a little bit more. Private health insurance options. So your options once you're on Medicare, if you want some sort of supplemental coverage, are Medigap supplement plans. There's also Medicare Advantage plans known as Medicare Part C, and there are Medicare prescription drug plans to cover your prescription medications known as Medicare Part D plans. We'll go over each of these. In most of the country, not in Minnesota, but in most of the country, your Medigap plans are going to be referred to as Plan F, Plan G, Plan L, and they're going to have a letter attributed to them. We don't call them that in Minnesota. In Minnesota, they're called Basic Plan, Extended Basic. There's riders available to help cover different things. Some insurance carriers offer a copay plan or a high deductible plan, but there are different options available with Medigap plans. With Medigap, that's going to cover only your medical. Medigap will not offer you prescription drug coverage, and it will not offer you dental or vision coverage, and some of the other benefits that Medicare Advantage will. A benefit of Medicare is that typically with Medigap plans, you don't have a network. You can see any provider across the country who accepts Medicare. It travels with you when you leave the state or the country. And if you move to another state, you aren't going to lose your Medigap plan from Minnesota. The downside to that is Minnesota has some of the highest priced premiums for Medigap plans in the country, and you may wish you would lose it, so you could pick up a Medigap plan in another state where it was a little bit cheaper. It's not that you can't, if you were to move to another state, Arizona, Florida, wherever, you could apply for a Medigap plan from that state, but you're going to have underwriting, meaning they're going to ask you health questions. And if you answer yes to any of the health questions, you would be denied coverage. That's a little different than Medicare Advantage plans. So Medicare Advantage, also known as Medicare Part C, and these plans include your prescription drug coverage also. But with Medicare Advantage plans, you're going to get your medical coverage, prescription drug coverage, dental, vision, hearing, fitness benefits. They offer a lot of extras that the Medigap don't for one monthly premium. Medicare Advantage plans do have networks that you would need to stay within. In Minnesota, we have two different types of Medicare Advantage plans. There are HMO plans and there are PPO plans. I tend to steer my clients in Minnesota, away from HMO plans if they're looking at Advantage plans because your options are more limited. With PPO plans, we have insurance carriers where 97% of providers are in network. So Minnesota is a little different than a lot of other states. In many other states, Advantage plans, HMO plans are really strong in those states, but you're going to be limited on who you can see and can't see. With Minnesota, it's rare for insurance carriers to have 97% of providers in their networks. So that's a benefit for Advantage plans in Minnesota. With a PPO plan, you're going to have national coverage with all the carriers in Minnesota that offer them, meaning they have national networks of providers if you're traveling that you would be able to see as in network. If you're on a PPO plan, you do not need a referral to see a specialist. If you're on an HMO plan, you likely would need a referral. Medicare Advantage plans do not move with you if you move out of state or possibly even from one county to another county in Minnesota. But the nice thing about that is if you have an Advantage plan in Minnesota and you move to another state, you lose your Advantage plan. And because you lose your Advantage plan against your will, it gives you the right to sign up for a Medigap plan in another state where they're cheaper without the health questions. So that's one of the benefits of starting with an Advantage plan in Minnesota, but you may or may not, there's multiple reasons why you would or wouldn't do that. Medicare Advantage plans are not going to ask you health questions. It doesn't matter if you're a smoker or non-smoker like it does with Medigap plans. And your benefits can change from year to year, and your premium can change. Both Medigap and Medicare Advantage, your premiums can change from year to year. With Advantage plans, your benefits can change from year to year. Any questions on any of that so far? Okay. And then if you were to go with a Medigap plan, you would want to add on a standalone prescription drug plan if you want coverage for prescription drugs. You're not required to sign up for a prescription drug plan. However, if you don't sign up for one when you're first eligible, when you have Medicare Part A and B and you're eligible, you wait until down the road when maybe you're not taking any prescriptions and so you don't see the benefit of signing up for a prescription drug plan. If you wait until down the road, you're going to be charged a penalty for the number of years that you went without a prescription drug plan. And that penalty will get added onto your monthly premium, and you're going to pay that every month for the rest of your life. So again, if you go with an Advantage plan, prescription drug coverage is included. With Medigap, you would want to add on a Part D prescription drug plan. Every insurance company has a formulary, and that's a list of medications that they cover or don't cover. Again, if you choose to meet with us, we're going to look up your prescriptions to make sure that whatever plan you choose, they're going to cover your prescriptions. It's going to tell you what the costs are going to be, and you're going to know when you go to the pharmacy or if you use mail order what your costs are going to be for your prescriptions. That's an important thing to know. Every insurance carrier has different tiers of coverage. Tiers 1 and 2 are going to be for generally generic medications, the lowest cost medications. Tiers 3 and 4 would be if you're taking brand names or some of the more expensive generics. And then Tier 5 would be if you're taking any specialty medications. Tier 6, there are some plans that have a Tier 6. This is going to be the lowest cost generic medications. But again, if you meet with us, we're going to go over all this with you based on the prescriptions that you're taking. Any questions on that? Okay. Last year, the government started something new, which is called the Medicare Prescription Payment Program. This is for people typically who have high-cost medications and they are going to hit their maximum out of pocket very quickly at the start of the new year or when they start a plan. So the Medicare Prescription Payment Program, there's no cost to enroll. Your insurance carrier, whoever you sign up for prescription coverage, they will send you the information. But if you sign up for prescription payment It's going to spread your cost of your prescriptions over 12 months instead of you getting hit hard in the first couple of months. Also, what the government has done is they've capped the costs of what your prescriptions are going to cost you for the year. So they've given a maximum amount of pocket on prescription drugs. This year, that's $2,100. If you were to reach $2,100 in your prescription costs before the end of the year, then you no longer will pay anything for your prescriptions. The insurance carriers are required to pay your costs once you hit that $2,100 cap. For some people I work with, they might hit, because of the expensive medications they're on, they could hit that cap by February or March. And once you're retired, it can be a challenge for some people to come up with $2,100, which is why the government started this last year. If you sign up for the program, it'll spread those costs out over 12 months instead of getting hit with it all in the first few months if you're in that situation. You're not required to sign up for it, but it's an option for you. If you do sign up for it, when you go to the pharmacy, you won't pay anything for your medications. The insurance carrier will bill you each month for your medications. Any questions there? Okay. The different enrollment periods. Your first enrollment period is going to be based around your 65th birth date. And it's a 7-month window. It starts 3 months before the month you turn 65, the month of, and 3 months following. So again, you have a 7-month window. If you choose to enroll in Medicare at age 65, that's the time frame in which you'd have to do that. If you're going to continue working, or you have a spouse who's going to continue working, when you reach age 65. If you're on that employer plan, you can delay enrolling in Medicare Part A and B at age 65 if you want to. There's reasons why you may want to enroll in Medicare Part A only. You don't pay a monthly premium for that. But if you're on an employer plan, when you reach age 65, you do not have to enroll in Medicare Part B. You can delay that if you or your spouse has that employer plan, and that's something that's going to work well for you. The reason you'd want to delay Medicare Part B is it really doesn't help you if you're on the employer plan, and you don't have to pay that $203 a month. Once you would be ready to retire or to leave that employer plan, then there's something called a special election period or special enrollment period that you would want to start 2 to 3 months. This is if you're beyond the age of 65. Start 2 to 3 months before you're ready to retire. You can get signed up for Medicare Part A if you hadn't done that, and or Medicare Part B. And then once your Medicare Part B is effective, you can make a supplemental plan selection to tie in so that you're not without coverage from when your employer coverage ends to where your Medicare coverage would begin. Any questions? Okay. Once you are enrolled in Medicare, every year there's an annual enrollment period or annual election period. Same time frame every year from October 15th through December 7th. And this is a time frame you can use if you want to look at either changing plans for the next year or reviewing your prescription drug coverage to see if your plan's still going to work for you for the next year. And if it doesn't, this is the time frame you can switch to something else. You're going to have this option every year. If you make a switch, it goes into effect January 1 of the following year. If you're on a Medicare Advantage plan, there's one more enrollment period, and that's a Medicare Advantage open enrollment period. This runs from January 1 through March 31st every year. And if you're on a Medicare Advantage plan and you didn't make a switch for whatever reason, or maybe you did, but when January comes around, you discover your plan had some changes you weren't aware of. It's not covering all of your medications like it did the previous year. Whatever the situation is, if you have a Medicare Advantage plan, you still have one more option to switch to another Medicare Advantage plan or just to leave it altogether. And this is from January 1 through March 31st. If you make a switch during that time frame, your new plan selection goes into the starts the first day of the following month of whatever month you made the switch. Yes?
There are multiple providers for Medicare Advantage plans?
There are. There's not in Minnesota and across the country. There are, and we have one less because UCare is going out of business in Minnesota this year. But yeah, we have Blue Cross, Medica. You probably want to stay away from Humana, but United Healthcare and some others. Yes. When I say you want to stay away from Humana, I mean I'm speaking their medical plans in Minnesota. In some states, Humana is great. Almost nobody, including the Mayo Clinic, will accept a Humana Medicare Advantage plan anymore. In fact, there's only 2 Medicare Advantage plans that the Mayo Clinic in Rochester will take now, and that's Blue Cross of Minnesota and Medica. They're no longer taking United Healthcare or any of the others that are out there, but they will still take Blue Cross of Minnesota and Medica. The clinics in Florida and Arizona will not take any Medicare Advantage plans, but they will take Medigap supplement plans if you're in those states and want to use the Mayo Clinic in those states. So what if you want to delay your Medicare benefits, working past the age of 65? This is either for you or if you have a spouse who's still working and you're on that employer coverage. We can compare the costs and benefits of Medicare to employer insurance. I've worked with enough Mayo retirees now to know that if you still have Mayo health insurance as an option, you're typically better off to keep that until you're ready to retire. Mayo's coverage is deemed creditable by Medicare. That's an important thing to know. And you can apply for just Medicare Part A if you want to. However, if you have a employer plan where you're contributing to a health savings account or an HSA, you do not want to sign up for Medicare Part A if you're going to be contributing to a health savings account still working at the age of 65. Once you sign up for Medicare Part A, you can no longer contribute to your health savings account. So if you're in that situation and you want to continue to contribute to your HSA, do not sign up for Medicare Part A or Part B if you're going to continue working. Once you are ready to retire, the rule is you want to stop contributing to your HSA account if you're beyond the age of 65. Stop contributing to your HSA account 6 months before you're going to want your Medicare Part A to start when you retire. And a lot of people forget, but if you forget to stop contributing to your HSA 6 months before, if you're beyond the age of 65, you're just going to get taxed on it. And the whole idea of an HSA is not being taxed on that. So it's not a huge deal, but you would get taxed on that. When you're ready to retire, like I said, 2 to 3 months before, you can apply for Medicare Part A if you don't already have that, and apply for Medicare Part B. You can do this online at Social Security's website at ssa.gov. If you've ever created an account for yourself on Social Security, if you log into your account and scroll down far enough, there's a link to where you can sign up for Medicare. And you'd want to start this 2 to 3 months before. It's going to take Social Security about a month once you applied for your new card for you to get it in the mail so that you can get signed up for supplemental coverage. If you've delayed Medicare Part B and you are beyond the age of 65, there is a form you will need your employer to fill out for you, and it looks like this. It's the request for employment information. Section A is completed by the employee and Section B is completed by HR. But this form is just verifying to Social Security that yes, you've had insurance coverage beyond the age of 65 if you or your spouse was still working. And once this form is filled out, then you submit this form at the same time you submit the form, your application for Medicare Part B. So again, you can do this online. If you need help with this, we can help you. Or if you go to your local Social Security office, you can do it that way too. But if you're delaying Medicare Part B enrollment beyond the age of 65, you'll want this form filled out by your employer. This form is what prevents penalties for not signing up at age 65. So if you're in that situation, you definitely want to have this form. And I know Mayo HR has the form available, but that's something that you would want to be aware of. Any questions? Okay. Your income has an impact on once you enroll in Medicare. So if your income is low or really drops once you retire, or maybe you know of someone who's struggling financially because they're on Medicare and they're just having a hard time even paying for their Medicare Part B premium, there's something called Extra Help that is available. You can contact or go online for Social Security or go to your county Department of Human Services. But if you are eligible for extra help, it can pay part or all of your Part B premium, that $203 a month, and it's going to help you with your prescription drug costs. But you can see the percentages across the top are the percentage of the federal poverty guidelines. And based on your family size, and these numbers, income numbers are for Minnesota, if your income is below these levels based on your family size, you're likely going to qualify for some sort of extra help that's available. The other side of that coin is if you're in the high income category. There's something called the Income Related Monthly Adjustment Amount, or known as IRMA, and there are thresholds for income. Every year, the IRS and Social Security are going to look at your federal tax returns from 2 years ago, and if your modified adjusted gross income is over whatever the threshold is for IRMA that year, they'll add on a surcharge to your Part B premium and your Part D premium. This year, the threshold is if you file your taxes singly, if your modified adjusted gross income from 2 years ago was over $109,000 a year, Social Security is going to notify you that they're going to add on a surcharge to your Part B and Part D premiums. If you're married filing jointly and your modified adjusted gross from 2 years ago is over $218,000 a year, Social Security is going to let you know that they're going to add on a surcharge to your Part B and D premiums, and that will be every month for the rest of the year, and then every year that gets reevaluated. These thresholds of $109,000 and $218,000, they tend to go up every year. So this is for this year's numbers, but you can see in the column that says Part B premium, if your income, if you're married filing jointly and your income was $250,000, then instead of paying a monthly premium of $202.90, you're going to pay a monthly premium of $284.10, and that's per person. And the higher your income was, the higher your surcharge is going to be, and also for your Part D premium. But again, that'll be every month for the rest of the year, and then every year that gets reevaluated. There are instances where maybe you had an inheritance, a one-time situation that inflated your income 2 years ago. If that's the case, when Social Security notifies you that you're going to owe this surcharge, they also let you know there's an appeal process. And if it was a special situation like inheritance or you sold a house or something, oftentimes they will grant that appeal to where you don't have to pay the surcharge. But if it was just based on regular income and cashing out of some 401ks or something, most likely they won't grant the appeal. So just making you aware when that time comes that if you're in this category, you may be adding a surcharge onto your Part B premium. Any questions with that? Okay. Premium costs with Medicare and private insurance. So you know for Medicare Part A, you're not going to pay a monthly premium if you or your spouse worked in this country for at least 10 years. Part B premium for most people this year is $202.90 a month. If you go with a Part C or a Medicare Advantage plans, there are plans in Minnesota and across the country that start at $0 a month, and they can go up to over $100 a month. But again, this is going to include your medical, prescription drug, dental, vision, hearing, and the benefits that go along with that. If you go the route of Medigap, you'll still have your Part A or your Part B premium, but Medigap plans, if you go with a copay plan with a high deductible, or a high deductible plan, they can start around $60 to $75. If you go with what's comparable to a Plan G in most states where you have a small deductible and then you don't have any copays, in Minnesota those run well over $300 a month. And then you would need to add on prescription drug coverage. And if you wanted dental and vision, you would need to add those on also. So Medigap plans can be considerably more expensive, but there are reasons why some people would go with those over Advantage plans. And if you sit down with us, we're going to help talk through those differences to you and maybe what's going to be your best fit. If you need to use via benefits, hopefully they'll do that for you also. But like I said, even if you do need to use via benefits, if you want that second opinion, we'd be happy to schedule a time to meet with you. Part D plans in Minnesota start at $5 a month and can go up over to $100 a month based on the plan that's going to cover your medications. So Medigap plans, if you go with the basic plan and add on all the extras, you can be looking at $400 a month or more. With Advantage plans, you'd be looking more at the range of 150 or so. So, at least in Olmsted County, yes.
That's per person?
That's per person, yes. So again, in the booklet that you got, there's a form. It might be white or this color or yellow. If you fill this out and put your email address, I will send you a thank you email and just ask you if you need help, and then we'll find a time to meet and do that. If you're online, let me go to that. Here's my contact information. You will be emailed the handout information this afternoon if you're joining us online. But if you need to connect with me via email, my email address is dbrown@trulink.com, or you can use Medicare@trulink.com, and then our 800 number, my phone number, so forth. But what questions do you have? Yes?
Are your services provided to us, or are you paid by Medicare?
Yeah. So we never charge anything for our services. If you sign up for a plan through us, we get paid a commission by the insurance carriers. If it's a Medicare Advantage plan, several years ago the commissions were standardized. So the commissions are the same whether you go with Blue Cross or United Healthcare or whatever. Medigap plans, we get paid a percentage of your annual premium.
Do you do an annual review and help us as time goes on?
We do. I'll go back to that slide. Let me. Yes, so we do. So every year, October and November, if you want us to review your medications, we'll do that. And if your plan has changed to where they're not going to cover all your medications, or maybe there's a better offering, we'll help you switch to that for the next year. That's all right. I'll go back to. What other questions? Any online chat? No? Okay.
I used to think that the Medigap was the way to go, but the Advantage plans sound pretty good based on what you provided. Do you have a feeling for how many people choose one or the other?
Yeah, of the people, well, in Minnesota, it's about 60% of the population now that goes with Medicare Advantage. People I work with, it's probably over 80%. Changing with Medigap too, even though they say that the benefits never change. That's as long as Congress or Medicare doesn't change things. But they're doing a test project this year with Medigap plans in 10 states. Minnesota's not a part of that, but where in the past you didn't have to worry about prior authorization with Medigap plans. Well, because they're trying to cut costs for Medicare, they're doing a test pilot project in 10 states where they are requiring prior authorization on Medigap supplement plans. So if that gets rolled out across the country, that's one less advantage that the supplement plans have had over the Advantage plans. So.
Could you go back to the slide that showed the fees for the Part C? I think it was like 75 to 100, 0 to 100. That's
Yeah.
Okay.
Yeah.
Thank you.
And it depends on what county you're in. Olmsted County has fewer options than a lot of Minnesota. This year, Blue Cross offers one Medicare Advantage plan in Olmsted. If you go, next door to Goodhue or some other counties, you're going to have more options. But it's mainly because of the cost of dealing with the Mayo, and people want Mayo in their network. Medica has more options in Olmsted County than Blue Cross does. If you're working with Via Benefits, as of last year, they were not contracted with Medica. So if you have to deal with Via Benefits and they don't offer you Medica as an option, I'd be happy to talk that through with you, because Medica has some good options, more options than what Blue Cross does if you're in Olmsted County. But there's several Advantage plans outside of Olmsted County if you're in other counties or in other states. Yeah. Yes.
I'm turning 65 in March of next year. Does it make sense to start planning and getting ready to sign up at this point, or is there going to be significant change in what's offered in the next 9 months?
Yeah. So his question, for those of you online, was he'll turn 65 next March. Does it make sense to start planning now? It can. I mean, things can change from year to year, but they're not going to change drastically. So yeah, I meet with a lot of people who are 63, 64 who just want to do some pre-planning to get an idea of where things are going to be when they're ready to retire or when they go on to Medicare. So yes. Okay, well again, if you do fill out this card, leave it with me, have an email address on there. I prefer to send an email versus calling because you can be in line at Target and you hate to be bothered by a phone call. But if you send an email, doesn't mean we always have to communicate by email, but if you fill this out and do that, then I'll send you a thank you and ask you if you're in need of our help. Yes, is there an online question?
Yeah, someone's asking, do you help people who are planning to retire to another state immediately after retiring?
Yeah, so we are licensed in several states. We can help you if you're planning on moving to another state. Yes, if we're not licensed in that state, we're associated with a national group of agents who we would be able to refer you to if you did need an agent in a state where we weren't licensed. But yeah, we'd be happy to help you with it. We can at least look it up on Medicare website to give you an idea of what costs would be and so forth. Yes?
This is kind of a funny question, but this information is going to only you, right?
It is. We do not sell your information. It stays within our organization.
Okay.
It goes to no one else.
Thanks.
Okay, well, thank you for joining online. Thank you for being here in person. If you do have a question you don't want to ask in front of everybody, I'll be around, but thank you for coming today.
Thank you.
Mhm.